Hi, this is Sherry Kimball, and this is for Nursing 620, the last case study. And this patient had shortness of breath, came in with shortness of breath and hemoptysis, and also has hypertension and a other significant history. So this is a 78-year-old male, white Caucasian. Like I said, he was there for shortness of breath and he was coughing up blood. And this is a new episodic visit for him. This is a regular patient, so not a new patient, but my provider doesn't see him very often, probably just once a year unless something's really wrong. So the onset with, he started coughing up blood about a year before that, and had gotten worse in the last few weeks. Now we didn't. I know that sounds weird because it kind of scared me when he first said that. But he kind of had gotten used to it, coughing up blood. He'd been to a pulmonologist like 6 months prior, and they examined him and did some tests, and everything was okay. So then I don't think nobody really did anything more. And he was progressively having shortness of breath in the last couple weeks with activity. So less activity and more shortness of breath. Um, was happening, he said, too many times to count. Shortness of breath and also coughing. I think every time he coughed, he would cough up blood. And then, you know, he said the last few days he really hadn't done anything because he just would get short of breath when he tried to do anything. So every time he coughed up blood, and he got short of breath every time he tried to work. And this is still a very active man that's working. He also said that he feels like his heart is racing when he's out of breath. So he noticed that mostly or only when he's short of breath. He's not having chest pain, no pain or bleeding anywhere else. He does not have a fever or chills. He's not traveled outside of the country or even outside of the state in the last year, and no weight loss or night sweats. Um, Seems to be worse when he exercises or with activity, and it's really not relieved. Nothing relieves the cough, coughing up the blood, and rest relieves the shortness of breath. So once he rests, he's not short of breath, but with any amount of activity, the shortness of breath comes back. Like I said before, he did see a pulmonologist in March because of the bloody sputum. They did a CT scan, it was normal, and there really was never no follow up after that. And he's not having any pain. The blood is increasing with an increased amount of coughing, and like I said, the shortness of breath is more increased with activity, or less activity causes shortness of breath. I did not get his past family history. Once I started getting information from him, I got a little concerned that maybe he had a blood clot or something major going on, and so I didn't really focus on that. I got his immediate history and then immediate kind of what was going on. He is married. His wife was in the office with him. He has grown children. He has never smoked. He works on a farm. He's a farmer rancher, and he's still very active. No official exercise, but he gets a lot of activity with his farm work. Does not drink alcohol or use drugs. He does drink 3 cups of coffee a day, but no soda, tea, or chocolate. And he has a history of hypertension for many years. And he had a TIA with a what they say mild, I guess, CVA in 2000. He had a mitral valve replacement with ring inserted in 2009, and CAD stent put in 2010. He does not have allergies. He's up to date on his immunizations. We were going to give him a flu shot, influenza that day when he came in, and his last tetanus was 5 years prior. These are the medications that he's on. You can read through these. I'm not going to read, but Plavix for his history of stroke, preventative, blood pressure medications, aspirin, again, the stroke risk factor there, and also recommendation. and then the lipid simvastatin for his CVA and CHD hyperlipidemia risk. So he denied any change in weight, eating, sleeping pattern, no fever, chills, weakness in extremities, just that he's short of breath with exertion and coughing up this blood. That was really his only concern. No rashes, no birthmarks, no bruising, no headaches, head injuries, seizures. Gets his eyes checked yearly, does wear glasses, but he denies any vision problems. No problems with his ears. Says that he has a slight hearing loss, but he conversed with me and answered questions and, didn't appear to be hard of hearing in any way. No stuffiness, nosebleed, or change in smell. He does see a dentist yearly and has no problems with his mouth or his teeth, alteration in taste. His neck is fine. He said he can move it. He doesn't have pain in it. He, never had problems with his neck. No problems with his breasts. No history of asthma, COPD, or wheezing. Like I said, he's positive for cough right now with productive with bloody tinged sputum is what he said. Really worse in the last 3 weeks, but it's been going on for a year. He does have high blood pressure, and it's more so high today at the visit. And the history that I mentioned before, cardiac history and mitral valve. Feels like his heart is racing, and he said it's racing mostly just when he's short of breath, and that's when he notices. But no chest pain, no swelling in his hands or legs, no GI problems, heartburn, vomiting, diarrhea, constipation. He does not have black or tarry stools. Appetite's good. No problems with urination, no problems with genitalia. He moves good, denies any problems with his bones or his joints or any kind of movement, coordination. Neurologically, he's hasn't had a concussion, loss of consciousness, seizures. He does have that CVA, TIA history about 15 years prior. No endocrine problems, no hunger, thirst, fatigue, cold, sweat. So this really is a healthy looking man, not, he didn't look his age and he didn't act like he was sick. When I walked in the office till I started talking to him, you'd never guess that anything was wrong. He seemed very pleasant, very appropriate. His wife, like I said, was in the room. She was you could tell she was a little more nervous. She was calm, but you could tell she was worried. He didn't seem worried at all. You can see here his blood pressure is fairly high. He does have he's on the high end of the BMI range there for potentially being overweight. Oxygen saturation is 96%. That's important to note. His skin was warm, pink, good skin turgor, no rashes, no bruises anywhere, no pain to palpation on his head. Cranial nerves were intact, pupils equal and reactive to light, no drainage. His ears look good, no abnormalities with his ears. Mucus, his nose membranes were nice and pink, no blood there or abnormalities, no drainage. Good gag reflex. Tonsils were intact. Everything in his mouth was normal. Neck supple. No thyromegaly, lymphadenopathy. No problem when I had to move and palpated. No problems with his neck. Spine was good. Normal range of motion. No tenderness with palpation. His lungs were clear. This man had clear lungs. Like I said before, O2 sat was 96%. Does cough up, and he showed me, coughed in a Kleenex and showed me the pink tinged. Um, it was a reddish pink, probably more than pink, but not profuse blood either. It was in the sputum. He was very tachycardic with an irregular rate when I auscultated his heart. No murmurs or rubs, no edema again in his hands or lower extremities. good circulation, legs were warm, no edema at all. But he did have a fast heart rate and irregular heart rate. Abdomen was soft, no discomfort or enlarged organs. Like I said, good range of motion, good movement in his extremities. Cranial nerves intact, negative Rongberg, just neurologically very very intact. I did not do the examine any part of his genitalia. He told me he wasn't having problems with that, and I wanted to figure out what was going on with his lungs. So as soon as I got a good history and kind of knew what was going on, I went right out and talked to the provider because I was like, oh no, this man's having a PE or something's going on, even though he had it for a year. So we got EKG in the office there, and it showed that he had atrial fibrillation with a variable rate from 60 to 100. Axis was normal. There was no obvious ischemic changes. So, atrial fib, but other than that, fairly normal. We wanted to get contrast CTA, so we needed to check renal function. So we did some labs on him. You can see those here. And also wanted to make sure there wasn't some abnormality, blood abnormality maybe that was causing the bloody sputum, hemoptysis, and the atrial fib and blood pressure and all that. So we did the CTA of the chest, and it was normal. It showed atelectasis and scarring kind of at the bases, but the report said there was no evidence of infiltration or blood clots. So we ruled out a PE and ruled out, pneumonia and TB and some of the other things that maybe we were wondering could be going on. Differential diagnosis would be, could be a variety of lung things. What I thought, first was a PE, the shortness of breath and the bloody um, tinged sputum. Also lung, I was a little bit worried that maybe he had a mass. Bronchiectasis, tuberculosis, could have been a cardiac abnormality, congestive heart failure, maybe causing then the heart abnormalities, the blood pressure, and the hemoptysis. VTAC, that high rate, even though he didn't act like he was having any cardiac problems, he also had a good O2, but still seemed to be something going on. So anything really causing heart abnormality, the heart to beat fast and irregular, and also cause high blood pressure, and then also trauma or inflammation to the lung tissues that maybe was causing the bloody sputum. So our final diagnosis was atrial fibrillation with rapid ventricular response causing shortness of breath, hypertension with compensatory tachycardia, and then hemoptysis, kind of all that as a result. So our plan of care was, first of all, we called the cardiologist and consulted with him. So all the recommendations here are, what we probably would have done, but also we made sure that putting him on new drugs and taking him off was the right thing. So we started him on diltiazem, 120 milligrams daily, and also Coumadin, 5 milligrams tablets daily. These are level 1 evidence recommendation. We DC'd the Plavix that he was on, and wanted to check his INR because we started him on the Coumadin in 2 days. We would titrate that to an INR of between 2 and 3. He was supposed to continue on his aspirin that he was already taken. Like I said, we consulted with the cardiologist. He also recommended a 48-hour Holter monitor, so we set that up. We set up an appointment with the cardiologist. The soonest he could be seen, I think, was in like 3 weeks. And then the patient was to return to us in 1 week for follow-up. He knew changes, chest pain, more shortness of breath, any other new or different symptoms, and we very specifically talked about, those, and I'll mention those in a couple slides here. If those happened, he needed to get back to the office or the emergency department. Second problem, hemoptysis. Since all the labs and the CTA of the chest were normal, we ruled out the PE, an infection or a mass. And so he was to follow up with a pulmonologist. We set that appointment up in about 2 weeks from that time. And that was level 1 evidence. Weinberger confirmed that with hemoptysis to see a pulmonologist and figure out what was going on. We ruled out major things going on immediately that we maybe needed to correct immediately. His shortness of breath was most likely due to the atrial fibrillation with the rapid ventricular response, so that he, wasn't getting enough air, our oxygen circulated, and so if with the medications the rate should be improved, slowed down, and also more effective, and then that would help reduce the shortness of breath. Like I said before, his pulse oximetry in the office was 96%, so he wasn't short of breath, while he was talking to us. He had good circulation there, and because the CTA was normal, it was concerning, but not like immediately concerning. And his hypertension should also be improved with the diltiazem. That should not only help the atrial fib rate, but also help the blood pressure. And again, we will recheck with him in 1 week. We talked to him about diet. The DASH diet would be recommended. Exercising is tolerated, so continuing with activity but not overdoing it so that he gets chest pain or shortness of breath, and to make sure that he takes his medications as directed. I believe he was not taking one of the blood pressure medications like he was supposed to. I can't remember the deal, but he was only taking half of the dose, or I think that's what it was. He was supposed to be taking it morning and night, and he was only maybe taking it in the morning. Anyway, we reiterated taking the medications as prescribed. So he was to follow up in 1 week with us. He knew that if he developed chest pain, dizziness, bleeding, any kind of bleeding from any orifice, so brushing his teeth or a nosebleed, or if he started to notice bruising anywhere, a fever, shortness of breath, anything like that to change, he needed to get to the ED immediately or call 911 to make sure he followed up with the pulmonologist and the cardiologist. And all these recommendations, like I said, were approved per se from the cardiologist, which would be a level 3. He's the expert level of evidence. USPSTF recommendations. He's on the aspirin already. It's recommended up for another year for him till he's 79. He may continue on that with the cardiology recommendation, and the cardiologist recommended he continue now. I question that if he really should be on all the anticoagulants, but the cardiologist wanted him to keep taking that. Blood pressure medication, or he's getting his blood pressure checked already. We know he has a problem, and we're monitoring that. And he's already on lipid medication. He's getting his lipids screened yearly also. So those are the recommendations for him. These are costs recommended for treatment. He is on Medicare and also has supplemental health insurance, so his cost out of pocket would not be very much, but it's costing somebody. And so anyway, this is a rundown between the cost helper and the GoodRx, just kind of generalities on costs for the different things that we ordered. These are the references. I recorded this once and forgot to do the next reference page, so I had to redo it. I also wanted to say that he did follow up. I was lucky to see he came back, and I was there for his week follow-up checkup also, and he was doing good. He still was a little bit lightheaded, and so we started him on hydrochlorothiazide, the diuretic, to help maybe pull a little fluid off and pull that blood pressure down. We also decreased the metoprolol, thinking maybe that was causing some lightheadedness. So I think we cut that dose in half. Trying to look on here. When he came back to get his INR checked, it was 2.8, so that was good. We wanted it between 2 and 3. Reminded him to make sure he kept his cardiology and pulmonology visits, and I think the following day he was supposed to get a Holter monitor on, so he was being monitored. He also got I see on my note here, his flu vaccine and his pneumococcal was given to him also. So anyway, he was doing good. He wasn't quite back to normal. Things weren't resolved, but um, we had not made him worse. I have not heard follow up since then. That was probably a month ago or so when we saw him. But also, we had not heard that anything went bad. We're a small community, so if something he would have took a turn for the worse or something significant happened, we probably more than likely would have heard about it. So I assume that what we did cured him. He was great, and he followed up with his specialist, and so hopefully he's just doing great. Thank you very much.